Hi YouTube, it's Courtney, coming to you with a 4-month post-op plastic surgery update, and I am just shy of my 2-year surgery. That'll be in like 3 weeks, 2 weeks, something, I don't know, when is January 6th. So, a little bit of background. My highest weight was 345 pounds. I had surgery with Dr. Sommer at New York Bariatric Group in Cortlandt, Manor, New York on January 6, 2015. I went into surgery around 328, I think, and my lowest recorded weight so far is 192. I had my plastic surgery on August 25th, 2016 with Dr. Richard Reish at Long Island Plastic Surgery Group in Manhattan. He did a tummy tuck with liposuction, breast lift with no implants, and that's good enough for me. I had some issues with my tummy tuck with a seroma. If you want to learn all about seromas, you can follow all of my videos and find out everything you'd want to know about a seroma. The seroma culminated like a month ago with a seroma extraction. We did that at the office. He gave me the option of doing it either under general or local. He said that he thought that I could handle it under local anesthesia, that he doesn't usually offer it to his patients. But he opened me back up about 5 inches while I was in the office and then cauterized the seroma out of me, which sounds exactly like what you think it does. I essentially laid on the table for an hour while I smoked, and, well, not like smoked, but like my body actually smoked. And he cauterized the seroma out. He said it was very large, and it was in my fascia, which is the separation between your muscles and your abdomen wall, and it's like a very small layer of stuff. And he said that it was really deep and we were never going to find that out unless he opened me back up, so we're really glad he did. It was a pretty rough procedure, I'm not gonna lie, it was painful. If you have the option and the means to do it under general, do it under general. I get really sick under general anesthesia, so I'm glad we didn't go through that. It would have made the recovery that much more horrible. So essentially I spent another 2 weeks at home recovering from that. It's just been one of those things. But the seroma is now obliterated. It is gone. There is no sign of it. So everything is healed with my tummy tuck now. I'm cleared to do normal activity. I saw him on Tuesday last week, and he looked at everything overall, and now that the seroma is healed, he says that he'd like to fix my breasts a little bit. They ended up a bit boxy on the bottom. So he'd like to go in and do an in-office procedure where he just rounds them out a bit just to give them a better look. I'll be doing that on Valentine's Day, but that's an in-office procedure and it's covered. Everything that's been done since my surgery has been covered under my initial surgery costs, so because I haven't needed anesthesia. I apologize if I sound weird. I have a cold that I'm getting over. But everything feels good with the tummy tuck. I'm really happy with it. I'll insert a video at the end showing what it's looking like now. A few things I wanted to just say about the tummy tuck before I move on to like life stuff and other things. I had my tummy tuck at 205, 206 pounds. I'm 5'8". My high weight was high. I really went into it because I needed the breast lift done and it was just more economical for me to do it at the same time. I've had a few people comment to me privately and on Instagram that they were really happy to see somebody chronicling their journey that wasn't at the normal and typical 150-pound goal. I didn't think I'd be a pioneer for something like this, and I did have concerns about like judgment in the community of going ahead and doing full plastics when I technically wasn't at goal. I didn't really have a goal. I had a I want to feel good in my body goal. I had talked to my bariatric surgeon probably this time last year, and I was freaking out because I had been sitting at the 210s for a while and I wasn't moving, and he kind of had a come to Jesus talk with me about, setting realistic expectations for my body structure and my height and my starting weight. And he told me that the 190s were a completely reasonable place for me to end up, and he'd be happy with me there, and that I would look good at 190 and I would feel good, and there's no reason why I should kill myself trying to get lower than that. And this is just kind of like my PSA. If you're struggling with your weight and you're looking at people that are your height or your same starting weight and they're lower than you or they got there faster than you, stop fucking comparing. Seriously, just stop. You know when you're done. You know when your body's done. You know what you're doing. You know if you could do better. And you know what you're comfortable with. Don't compare yourself to other people that happen to make goal or keep goal or whatever. Your goal is what you want it to be and what you need it to be in your life. And if plastics are where you're at and what you need at that moment, then by all means, if you have the money and the means to do it, then do it. It completely changed my life. My breast feels so much better. Even if I hadn't had the tummy tuck, I would be in such a better position just for having my breast lift done. They were so bad. And nobody could sit here and tell me not to get it done. I mean, I had lost 150 pounds. Bite me. Sorry. And I have always felt this way in my life, and I never conformed to what people expect of me or what they think is correct for me. I march to the beat of my own drum, and there's a cat coming, so if you can see him, sorry. I don't think it's fair to compare yourself to other people, and if you and your surgeons, including your plastic surgeon, think that it's time, then it's time, and damn anybody else who thinks otherwise. If watching my journey helps you find some peace in that, great. There's some really excellent plastic surgery people out there that have had plastics at goal or above goal, and they all look great. And I think that it's important to talk about that goal means different things for different people. But I talked to my plastic surgeon, and he was realistic with me about my results, and my bariatric surgeon was realistic with me about weight expectations, and I'm hoping that I can, keep my weight where it is and move on and do what I have to do. But there's no judgment here if you're, 210 and you're sitting there and you can't move anymore, but you've got a lot of loose skin or a pannus that you need to get rid of. Get rid of it. I mean, who am I to say not to do that? So, I don't know that you'd necessarily have better results at a smaller weight or with less fat on your body. I mean, there is liposuction. I did have some body contouring done. That's very obvious if you look at my before and after photos. I've never hidden that. I still have fat left. I still have pudge. I don't have washboard abs. I wasn't going in it for washboard abs. I was going in it so that I could feel better about wearing the clothes that fit me already. I didn't go down a pant size. I didn't have enough skin to remove to go down a pant size. I don't have to wear shapewear with pair of jeans anymore. I don't muffin top over my jeans. When I sit, I have a little bit of a pooch. But that's something I can't fix in the gym by losing an extra 10 pounds. If I care to. I don't know if I do. Right now, I'm going to look at toning up and, toning my body up. My butt's a little saggy. I'd like to fix that. But, I mean, I'm perfectly happy with where I am. And I hope that if you're choosing plastics or thinking about it, or if you've been stuck at a goal weight, or if you had a regain, but you still really need plastics, that you really look at, the big picture and see where you've come from and where you're going and what you're doing, and just do what's right for you and not what you've been seeing in the community and what's been told to you in the community, or even what's been told to you by certain plastic surgeons in the community. Find a good, reputable, board-certified plastic surgeon in your area. Let them look at your body. Let them talk you through it. Tell them what your concerns are and see if they're realistic at the weight that you're at now. I mean, if you go into it looking like you're going to have washboard abs and you're going to have absolutely no loose skin left over, you're going to be disappointed. You're just going to be disappointed. I'm still fluffy. Like, I'm 190 pounds, I'm going to be fluffy. So it depends on what you're comfortable with and what you want to set as your goals. So that's all I gotta say about that. I'm going to be kind of on and offline a lot in the next few months. Josh and I are moving. We currently live in the Hudson Valley. We're moving to northern New Jersey. It will be like 15 miles, I wish, 15 minutes from work. And it cuts my commute in half. Right now my commute's 2.5 hours one way. This will cut my commute down to an hour, so it's more than in half. Which maybe to you seems like, oh my god, you still have an hour commute, but to me that's getting an hour and a half of my life back, actually 3 hours a day of my life back. So we're getting rid of the townhouse. Well, we broke our lease. We found a really beautiful 2-bedroom apartment down in Essex County in Jersey, so if you're around that area, give me a shout out. We're looking for new friends, and so we move on January 22nd, which means I have to consolidate a 4-bedroom house down to a 2-bedroom apartment, and we have a lot of shit we have to get rid of. So things are going to be busy. The holidays are here, blah 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 blah. I'm going to try to make a 2-year surgiversary update, but I don't know. I mean, nothing's really changed for me. I don't really have any deep insights on various things. I will make an update after I have my breast modification, just to like tell you how it was, but that's going to be minor. I'm just going to be able to work for like 2 days and then I'll be back. But, you know, otherwise I feel really good, and I'm happy to say that the seroma debacle is over. And I think there's probably 900 other things that I was thinking about making a video about, but I didn't and haven't. But I did want to update everybody because I have been getting questions about how I was doing, and I know that there's a few of you, like Brandy. She's going in for plastic soon. I know Liz is thinking about it, so I just wanted to make a quick little update and let you guys know like where I landed. I'll make a 6-month update and let you know if like anything dramatically changed, but I think at this point it's safe to say that I'm healed, and I don't have much swell hell. At night I get a little puffy, but for the most part it's fine. I do notice when I'm bloated a lot more. I can actually see that now. But everything, my clothes fit great. I feel really good and really happy with my results. My plastic surgeon is absolutely amazing. I'm probably going to have a scar revision on my tummy tuck incision just because we had to go over the incision a few times for drains and for stuff. So, but that's again an in-office thing, and I'm sure whatever he does will be perfect. My breast on the other side, it was just, I had a lot of skin that had to be removed, and I didn't really expect beautiful scarring. I don't scar well, I keloid all the time. So I do have a few keloids on my tummy tuck, and then underneath my breast it's a little bit more red and spread out than I'd want, but I'm giving that time to heal. My vertical incisions that you actually see, they look beautiful. Like, you can barely even tell that they're there, so I have absolutely no complaints with that. I'm sorry you're not getting boob shots. So if you privately message me and we're friends, then you've seen my boobs, but not all of YouTube is seeing my boobs. Sorry, it's just not happening. So if you don't already follow me on Instagram, I post periodic updates, although I'm probably going to stop doing tummy shots because there's only so many times I can show that before it just gets narcissistic. What else? Let me end with an NSV. What's an NSV that I've had recently? I had professional photos taken of me when I was at work for a conference, and I didn't hate my photos. So there's an NSV for you. I was actually really happy with the photos. My mom has been begging me for like an updated professional shot of me for her mantle, so that's what she gets for Christmas. Yeah, and I think that's about it. So I will be in touch, hopefully for my 2-year video, and I hope everybody's doing well and you all have a lovely holiday, whatever you celebrate. Okay, bye. This is what I look like in a pair of normal pants. These are from the Loft. Wear size 32, which equates to like a 12 or a 14. I don't even know. I think it's a 14. But I wanted to show like what I look like in actual pants because I think that's important. I like my pants a little bit high waist. I was a little concerned about what it would look like in the back here because my waist is so narrow and everything fits good. I mean, I still have a little bit of a pudge, but that's something I can't fix. He obviously didn't get rid of all my fat, but I feel pretty good about how I look in a pair of pants. Now I used to have this muffin top that went over, which was really annoying. So this is what it looks like. And I can't really show my scar, it's so low. Also, I can't really shave yet because I can't feel anything, so yeah. Forcing or anything, like this